Hi folks, it's Kevin here, your host for the Bodyworker. Tonight we're going to do some manual lymph drainage. Can I get this right up? My friend Catherine came all the way from Dallas. Catherine, you want to tell us about manual lymph drainage?
I'd love to, Kevin. It's one of my passions in life because it's changed my life so much and it has the potential to help a lot of people. So I'm real excited anytime I can get together with someone and share some experiences about manual lymph drainage.
So Dr. Vodder was the one that came up with this first?
Right. Back in the 1930s, Dr. Vodder and his wife Estrid out of Copenhagen, Denmark, came up with this. And it's working on helping the body to detox itself. We work on cleansing the loose connective tissue and making it move on through the lymphatic vessel system. And since the lymph vessel system is what we do, or what the body uses to cleanse itself, it's a very powerful massage, although it's a very light technique.
All right, so we'll have some information. Catherine Thrift from Dallas, and if you need to get in touch with her. Now, you're a certified trainer in manual lymph drainage?
I'm a certified, internationally certified Dr. Vodder manual lymph drainage therapist as well as an instructor in the basic course. I'm in the process of certifying for the second course, which is Therapy 1. It's quite an involved process.
So how many are there of you? How many certified instructors are there in the world, or even just real therapists?
Okay, of the therapists, there are about 250 in North America, so Canada and the 50 states. And of the instructors, there's 7 of us, 3 in Canada and 4 in the United States.
So it'd be worth a drive to Dallas.
Exactly.
Okay, and Catherine, I think, is going to come to Austin to do some trainings in that in probably 95, 96.
We have some things in the works right now. I travel all over the country, as do the other instructors.
So it seems to be getting a lot of attention lately.
It truly has, and the reason for that is because there have been a lot of articles written on lymphedema, and primarily post-mastectomy lymphedema. And the medical community doesn't really have a lot to offer those people who have suffered lymphedema after a mastectomy. So we come along with manual lymph drainage. In fact, there was an article in Parade magazine in I think it was September of '94 that talked about there are over 2 million Americans suffering from lymphedema.
Now, you said that you can't do a full body treatment in this because it's so powerful. You release so much toxins that you can't handle it.
Well, we seldom do a full body, mostly because it takes too much time and also because of the toxins. It takes about 2.5 hours to do a full body.
What am I going to have to do, like, after this segment? Am I going to not be able to walk? Or?
Oh, no, you'll be perfectly fine. No, you just want to be sure and drink plenty of water.
Okay. Not coffee.
No, not coffee, not coffee, not coffee. Water, water, water.
Water, just filtered water. Okay. Well, I guess I'll just lay back and enjoy. This is my
Okay, let's
favorite
get
part
to
of
it.
doing the show.
You're all tucked in here. Manual lymph drainage is very different from a lot of massages in that we use a very gentle touch. And what we're doing is that we're moving the skin rather than working on the muscles of the body itself. What we're doing also is that we're stretching the skin as far as it'll go, releasing the skin and letting it bring us back to the original position. We work on helping the lymph vessels to increase their lymph angiomotoricity. That's a fancy way of saying the speed at which they contract. The faster they contract, then the more fluid that they're able to move through the lymph vessel system. The sooner it can get through the system, the sooner it can get out of the body. So what we do with manual lymph drainage is we always start with the neck, because this is where all of the body fluids in the lymph vessel system drain to, is the neck. And we call this area up in here that I'm getting ready to work on the terminus. The reason we call it the terminus, and that's a manual lymph drainage term or an MLD term, is because this is where all of the fluid drains to. Kind of like a bus terminal, the end point, it all drains in there. MLD is a very slow, gentle, rhythmical massage. and it requires a lot of repetition. The reason for that is because the lymph vessel system does not have a pump of its own. It depends on auxiliary pumps, such as arterial pulsation, musculoskeletal contractions, peristalsis. So what we do is we come along with MLD and we encourage the lymph vessel system to increase the uptake of fluid that's in the loose connective tissue and move it on out. Like I say, we always start with the neck. That's because of the between 600 and 800 lymph nodes in the body. About a third of them are in the head and neck area, all the openings we have there. So we have a full, complete series that we do on the neck. This is what I just did on you as a short neck. Not that you have a short neck, you understand, but rather I'm pretending as if we have done sessions before, and this is what I would want to do, is just open up the neck area so that I could start working on other parts of you. We have four unique strokes in MLD. We have the stationary circles, which is what I was doing, where we're stretching the skin down towards the table and releasing towards the baby finger or towards the body. And then we have some other strokes that are called the pump and the scoop and our beloved rotary.
That better be nice to get the rotary.
Yeah. It's a real good technique to use on the back. It really feels good. In fact, MLD feels a lot like cat paws. You know how they make those little biscuits?
Biscuits.
Mm-hmm. Because it's a pressure and a release phase. Both of those are equally important in MLD because we want to stretch the skin as far as it'll go, release the skin, and allow it to bring us back to that zero phase. The reason for that is that Professor Misslin, who's a Swiss scientist, found out that the lymph vessel system responds to passive stretching, and it does it in a longitudinal and diagonal stretch. And if you look at the movement of a longitudinal and diagonal stretch, it comes out to be a circle. So we stretch the skin as far as it'll go, release, and ride the skin back. It looks as if I'm not doing a lot when I'm working on your skin, except that if you'll look very carefully at your neck, you'll see that I'm moving lots and lots of skin. I always tell people when I first start on them, I bet you think I can't possibly be doing any good because this is so light, especially if they've had classical massage where they really get in and rearrange the muscles. But what we're doing here is working on the skin, helping the skin to move. The reason for that is that approximately 40% of all the lymph vessels are in the very first section underneath the skin, right above the fascia. And we can influence those with our hands, with the stretching movements. It causes a pumping action that helps the lymph vessel pump the fluid on around the system. And the thing about MLD that is very different than classical massage is, you know, with classical massage, if I were going to do your arm, I would start out at your fingertips. Whereas with MLD, I start up proximal. I start up close to the area. The reason for that is that I want to be able to stimulate the lymph vessels that are more healthy and then also allow time for the fluid to be moved into this area. So I want to show you a pump. See what a pump feels like. A pump really stretches the skin. All of our movements stretch the skin. Can you feel that stretching? Mm-hmm. So there's a pressure phase and then a release phase. And that pumping allows for the fluid to move along in the lymph vessel system. Dr. Vader and his wife worked as physiotherapists in the French Riviera. And I know it's a rough place to have to work, but you know, everybody has to work someplace. So they were over there and they got a lot of English people coming there, and they had a lot of sinus problems and swollen lymph nodes. Well, at that time, back in the 30s, it was pretty much taboo to work on the lymph vessel system because they didn't know what would happen with it. They thought it was like a Pandora's box, and if you open it up, who knows what'll happen. But they started working on it and found that they got really good results by stimulating the lymph nodes and helping them to clear. So he developed the whole system to work on the whole body. We have 9 different body parts that we work on in MLD. We have the neck and the face, the arms, the chest, the abdomen, the legs. Then on the back side we have the nape of the neck, the back, and the buttocks. And all these areas have particular drainage ways that they go. For example, right down the center of our body, front and back, we have what's known as a watershed. And a watershed is a lot like the Rocky Mountains. You know, water that falls on the east side flows to the Atlantic, and water that flows on the west side goes to the Pacific. Well, on the body, the midline helps to divide. The right side of the body drains into, depending on what part of the body where we are. Let's just use the chest, for example. It comes into the axilla, or underneath the armpit. And the skin of the back also comes each side to its own side.
Show that in that chart you got?
Yes, it shows that.
chart.
The little dotted line down the middle shows the watershed, and there's also a watershed at the waist. And contrary to what you may think, the governor of the great state of Texas, Ann Richards, did not pose for the big hair picture. But you'll notice that it shows that little dotted line down the center, and that's the watershed. So what happens, let's say for example on a mastectomy, where a doctor comes in because of breast surgery and removes part of the breast or all of the breast, and the nodes, many of the nodes underneath the armpit, because the nodes are where cancer cells can be. So they go along and they remove many of them. Well, one of the functions of the lymph node is to help concentrate the fluid, and the whole arm drains into the axilla or the armpit area. So if you have a reduction in the number of lymph nodes, then you also have a reduction in the body's ability to be able to concentrate the fluid. So in about 15 to 20% of the population that has had a mastectomy, they will, at some point in their life, probably develop lymphedema. Now that can be anywhere from just a few weeks after surgery or 5, 10, 20 years later. There can be an episode like a scratch on the wrist or a scratch on the arm from a cat scratch or a dog scratch or even a rose bush prick that sets up the body for an infection, and then the infection causes the arm to just swell up. There have been several articles written in the last couple of years about the case of the ballooning limb in Prevention magazine, and then this article in the Parade magazine a couple of weeks ago or so that talks about lymphedema. As I stated, there are right now over 2 million people who are affected with lymphedema, and most of the time the doctors don't know what to do with them except maybe send them to get physical therapy with a pump. They don't realize that there is a non-invasive procedure like manual lymph drainage that helps the body not only to move the fluid out, but it also helps the body to carry the proteins out of the system. That's one of the problems with the pump, is that it helps to move the fluid, but it leaves the protein in, the loose connective tissue. And protein has a tendency to attract water. So you move the water out, leave the proteins there, so the water just sucks the protein just sucks the water right back. So you haven't really accomplished much. But what we do with MLD is we come along and we help move not only the fluid out, but also the protein. And it helps the severed lymph vessels reconnect and helps to develop collateral pathways or alternate pathways. Since the arm normally drains into the armpit, we work with MLD to shift the fluid to another position so it can move out of the arm. That's why it's so very helpful with edemas, post-mastectomy, post-hysterectomy. And also, we work on edemas that affect the central nervous system and the peripheral nerves, such as Meniere's disease, migraines, normal headaches. We also work on edemas of traumatic origin, such as reflex sympathetic dystrophy, which is, as physical therapists will tell you, is a condition that you don't wish on your worst enemy, let alone somebody you like. It's a really difficult condition. But since one of the effects that we have with MLD is to help bring the sympathetic and the parasympathetic system back into balance, and with RSD, the sympathetic is like stuck on hold, we help to bring the body back into a more balance. There's a $25 word called sympatholytical response that we help to produce, and basically what that means is that we lower the activity of the sympathetic nervous system and reflexly stimulate the activity of the parasympathetic. And the parasympathetic is the nice relaxation phase of what you feel when you get a nice massage or you're getting ready to go to sleep. So MLD, MLD has a lot of wonderful, wonderful indications. So I'm just going to do a little work here on your arm and help you to feel this nice pumping action that it produces. You see how it's more of a surface. We're stretching the skin. I'm not sliding on the skin. We never slide on the skin. That's also why we usually don't use oils, because we want to have nice, good contact with our hands. If anything, I'll use a little cornstarch if I'm a little damp on my hands or if the body's a little damp. We never produce reddening. You know those gangster movies where they come in and you see the gangster in the sweat room and the therapist is just beating away on them and how red they get? That's because what's happening with the body is that it's increasing filtration. In other words, there's more fluid coming out of the blood capillary, which is exactly what you want to happen with classical massage. But with MLD, what we do is we work on the other side, reabsorption. We want the body's fluid to be reabsorbed by the blood capillaries because the system's not able to handle the fluid that it has. So if you come along and do some tapotamine or petrissage or something that causes the body to get real red, it's bringing more fluid into an area that can't already handle the fluid that it has. So we do a lot of things like that with MLD. It has 4 basic effects, and I talked about one of them being the pain reduction, one about the sympatholytical response by working on the autonomic nervous system. We also have what we call an immune response, and at this point in time at least it's a hypothetical with clinical demonstration because we don't have the scientific documentation right this very minute on it. We're working on that. But I know for myself that since I've been getting MLD that I get fewer colds. They last a shorter period of time. Overall, I feel better now, 10 years after starting to receive my first MLD, than I did 10 years ago. So it's true, I'm not getting older, I'm getting better. And part of that's because of the MLD. In fact, that's why I got started with MLD, is that I started receiving it for some conditions that I have with my legs. My legs, 10 years ago, were like little tree stumps straight up and down, and they felt like balloons that were filled with water. There was no give to them at all. And a long walk for me was 15 seconds. And to stand up like this, hey, would have been impossible. But I started getting MLD, and it moved the fluid, and I'm doing so much better. In fact, now I can stand for 8 hours and do a lecture. And I do teach all over the country, as do the other instructors. Okay, so that was one of our movements, was the pump. Now, let me show you a scoop. Heather, can you close in on this one? I'm on the wrong side of you, aren't I? I'll tell you what. Let me come down here to his leg. We'll get on the outside. Okay, let me have you bend your leg. And let's keep it up. Good. Okay, so this is a scoop that I'm doing on the bottom and a pump on the top. I think MLD is a beautiful massage to watch as well as to receive.
It's pretty soothing.
Yes, it's very soothing. The reason for that is that one of our indications is a pain reduction, because we work on the mechanoreceptors. We help to, you know, you've heard about the gate theory of pain reduction, where it helps to inhibit the pain signals that go to the central nervous system, to the brain. The reason that we're so effective with that is because we work with the mechanoreceptors, which are called touch receptors, and they respond to a press and a release. For example, if you put your shirt on first thing in the morning, you may be a little aware of it, but as the day goes on, you're not aware of it because the mechanoreceptors are no longer being stimulated. There's this constant touch. They're phasic receptors. They respond to a pressure and a release phase. So we come along with MLD with our press and release, our stretch and release, and it allows the body to inhibit the pain signals that are sent to the brain. It's very, very soothing. In fact, one of our principles is it does not cause pain. Okay, let's put your leg down here. So that was just an example of the strokes. Now I'll wait till I turn you over to show the rotary.
The
rotary.
She'll wait till I face down. I can't do anything, right?
That's right, that's
Okay.
right. But it feels really, really good. Okay, so what I'd like to do then is to actually work on your arm as I would just for a relaxation. Okay, so I'm going to be kind of quiet here for a couple minutes. If you have any questions, feel free to ask, okay? Okay, so just relax your arm. That's good. You're holding, you're helping me.
All right.
Okay. Can you see that, Heather? We also do a lot of repetition, as I said, because of the fact that the lymph vessel system doesn't have a pump of its own. You had asked me earlier about the certification program that it takes to become an MLD therapist. There are 4 courses for a total of 160 hours. Each course is a 40-hour course. The first course is called Basic, and in it, I liken it unto learning the alphabet of MLD, because we do have different strokes. We have 4 different strokes and then the 9 body parts that I was telling you about. We work on learning the lymph vessel system and the pathways. Then after people have finished that course, then they receive a certificate of attendance and they're able to do work on healthy people. It's a wonderful relaxation massage. The second course, if we take our analogy of learning the alphabet, Therapy 1 is like learning to write simple sentences. We work on refining the strokes, because although it looks very simple, it does take some degree of effort to learn. As they say, anything worthwhile takes some time, energy, and effort.
Mm-hmm. So this is like another part of the language of touch, and you're just learning a different version.
Exactly. So Therapy 1 is the second course. We refine the strokes there, and then we take some joint mobilization, plus the fact that we learn some strokes interaurally, because we do a lot of work with sinus congestion, swellings in the head, like glaucoma after a stroke, when there's swelling in the brain. We help, also dental surgery. Man, it's great for dental surgery. Pre and post. Helps to cut down with bruising. So then there's an exam after the second course. Then you're eligible, if you successfully pass that, to go on to the next 2 courses, which are therapy 2 and 3. And if you think about basic being learning the alphabet, and therapy 1 about learning to do the simple sentences, therapy 2 and 3 are like learning to write grand compositions, because in that you learn the strokes necessary to treat lymphedema, as well as the 60 different pathologies that we treat with MLD. After that course is completed, there is a final examination. There are oral exams in front of the doctor of the Dr. Rotter School and the medical director and the clinic director as well. We learn bandaging because it's very important to bandage after we've worked on a lymphedema, because the skin has stretched and we have to apply external compression after we've helped move the fluid out, so that
coming back.
Exactly, and also it gives the skin time to remodel itself. Since it's been stretched out, it helps to bring it back down. So that's a very intensive work in order to do therapy 2 and 3. We have, besides massage therapists who do MLD, we have physical therapists and occupational therapists, nurses. We've had one doctor who started the training so that she could get an idea of what it was all about to be able to send patients. In fact, probably I would say 90% of my practice is physician referral because of the types of pathology and disease that I work with. Okay, now these are thumb circles that I'm doing here on your wrist. It's a type of stretching that skin and releasing, riding the skin back. Dan, can you see how the skin's really stretching here? Can you get a close-up of this? See that skin just stretching? And how would you describe the pressure that I'm applying?
It's like I can barely tell that you're stretching. I can feel the skin kind of moving, but and you're right on the bone too, so it's like not much pressure.
But you can really see the skin moving.
So I feel like behind my ears I'm feeling something. Does that mean I'm having drainage in my head here or something? Or?
It wouldn't surprise me.
My head probably needs to be drained.
Your head needs to be drained, huh? MLD is a very structured massage, unlike a lot of classical massage where you can kind of just do your own thing. We have to work with the lymph pathways. So first of all, we have to know how the lymph flows and the pathways so that we can take it in the direction that the lymph is moving.
So, since you only do part of the body, did people like come back for 2 or 3 treatments to end up getting the whole body coverage, or does it matter?
It depends on what they're coming for. If they're coming for a relaxation massage, we would do, say, half a body, and then the next week we'd do the other half. Most of the time, as I said, I'm seeing people who have pathology or diseases, so we work on the area that is in trouble. For example, if it's a lymphedema post-mastectomy, then I would work clearing the pathways so that the fluid would be able to move out of the arm rather than on a leg, because the problem is in the upper part of the body. Now, if we have, say, a leg lymphedema post-hysterectomy, then we'd work on clearing the pathways, which would be the neck and the abdomen, and then the legs. With conditions such as reflex sympathetic dystrophy, a lot of times there is...
Is that what I
That's
have?
a mouth one. No, believe me, if you had it, you'd know it. Often the limb is too tender to touch, so we'd work on the other side because it has what's known as a contralateral effect. We can work on one side and influence the other. It's wonderful on burns and scars. It helps to heal a lot. It helps the body heal from the inside out rather than just having a covering over the top of the wound. It also helps the scars to not constrict, and also if there is keloid taking place, you know, where that little red lump lifts up, we can help bring a healing to that area and smooth it down. For myself, I had an exploratory appendectomy, so I mean I've got a scar about yay long, and it was about that wide, and it had keloid. And it was about 15 years into the scar that I started getting MLD, and now it's just smooth as glass. I mean, still as long as it was, but it's not as
Scar
raised.
tissue isn't showed that much? Or?
Right. What it does is it helps bring nourishment into the area and
Right.
toxins out, and it helps to stop adhesions. Okay, so let's do a leg. What do you say?
Sounds good.
Okay, normally I would do your abdomen before I do your legs, but since we're being a demo here, I will.
Use me as you see fit.
Oh, okay. Sally, I'm going to do this leg rather than the other leg. Is that okay?
I just want to commend Catherine on remembering everybody's name. She's doing really well.
Thanks. I'm a name person. I really, truly am.
There's lots you can teach me.
Well, you know, our name is our identity, and to be able to remember a person's name says, hey, I care enough about you to remember who and what you are.
So, since I forget names, I don't care.
Well,
right?
I wouldn't say that. I didn't make the opposite.
Okay. I'm relaxing.
That does kind of take a nice deep sigh here. A lot of wrist action with MLD in the sense of lifting the wrist. Rather than flying elbows, we have wrists that lift. Stretching that skin, moving the skin. My students have dreams of me saying MLD is a skin technique because I say it so often in class. Not only is it a skin technique, it's a light skin technique because we're moving the skin rather than the muscle underneath. So I talk about the pressure being like butterfly wings and angel kisses because the pressure is only about ½ a pound. Very, very light pressure. You can really see that skin moving. We're very fortunate in this country that MLD has started taking hold because there are a lot of people who can benefit from having manual lymph drainage. And with the certification process, it's really good to know who's doing your work. You know, it's like anything, when something becomes popular, then a lot of people try and jump on the bandwagon. And that's why I encourage people who are either going to go for training or to look for a therapist to make sure that you have a certified instructor and a certified therapist. We have a professional association now called NAVALT. That stands for the North American Vater Association of Lymphatic Therapy. And we work in conjunction with the Dr. Vater School to maintain a list of all the certified therapists in North America.
So you said there are some people here in Austin?
Yes, there are 3 here in Austin.
And so most in places around the country, there's usually somebody close by, or?
Well, at the current time, there are only about 250 fully certified therapists. Now, there are probably close to 2,000 who've taken the basic course, but for whatever reason haven't chosen to go on.
So those are the people that can work on healthy people?
Those are people who can work on healthy people. Right. But I will say that one of the things that the Dr. Votter School does to help maintain the purity of the technique, as well as making sure that we're getting the results that we say that we get, is to require everyone who's a graduate, in order to stay on the list, they have to go for recertification every 2 years. So it's not just something that you all of a sudden wake up one day and say, I are one. You know, you have to go through the process in order to train and then to stay current, because there are things happening in the field all the time. And we have the Dr. Votter School annual review that's held in conjunction with NAVALT's annual meeting of members.
You have a newsletter or anything like that?
Yes, we have a quarterly newsletter. Mighty fine publication, if I do say so myself. Yes, it's a good organization. Like I say, we maintain the list of all the certified therapists to make sure that when people call and are looking for a therapist, they can find someone who is qualified. In Germany, MLD is the 4th most prescribed physiotherapy that there is. It's, like I say, it's well known and well respected over there. It's over 60 years that they've been doing it in Europe. It's only been about the last 10 or 15, maybe 15 or 20, that it's really been well accepted in Europe because of all the documentation. They do a lot of scientific research on MLD because they wanted to prove that we couldn't possibly do all the things that we say that we do. And of course it ends up proving that we really do what we say we can do. Okay, so now we're going to do the pump and the scoop. Oh, you have that really tucked in there, good Sally. So just pretend like your leg isn't going to slide, okay? See how we really get that skin moving.
So this type of treatment would be comparable to when you were calling classical massage?
Well, classical Swedish massage.
Yeah, I'd never heard classical before. Is that something that they talk about in the school, or?
No, since Swedish is really what most people think of when they do massage, that's why we call it classical.
It's an interesting term.
Mm-hmm. Like our classical music that we're hearing.
Yeah.
So in one of the programs you were talking about your injury that you had, how's your leg doing now?
My left leg?
Mm-hmm.
After you worked on it?
No, just...
In general, it's fine. It's just a little bit shorter. But it doesn't hurt when it gets cold or anything like that.
Oh, that's good.
I use it pretty much.
Now this is more of an advanced stroke. This isn't a basic stroke here, so if you took basic, don't be concerned.
What is this stroke called?
Well, it's a pump with movement over the ankle. Okay. Now I'm doing what they would learn in basic, which is the thumb circles. Mm-hmm.
I'm starting to recognize these already.
Hey, good. And then this one I just love. This is like an edema stroke over the foot. To me, it just feels so good. I love to have this one done.
So I get some clients that have that, like swelling around the ankles. That's what this is going to work for, right?
Right. But first you have to clear pathways because you have to have some place for it to go.
For it to go, right.
Mm-hmm. Exactly. And then we finish off. And So left virage. Okay. So I'm going to have you turn over so I can do the rotary on you.
Okay.
It's not as bad as
Everybody's been waiting for here. Know that.
Okay. Where do you want me to put your mic? Down here so you can...
Yeah, it's
Okay, are you comfortable?
yes, I'm feeling very good.
Very good.
This will be the one time you can hear me talking when I'm in the face grade.
Say we use powder or cornstarch rather than oil because we want to maintain contact with the skin. So our rotary is really, you can see the skin stretching on the rotary. See that skin moving forward and releasing? We move the skin rather than slide the skin. And then remember I was telling you about the watershed. The spine is the watershed on the back. So we move the skin on the right side over to the right. And then we move the left over to the left. Since the skin of the back drains into the axilla, or the armpit, all of our movement takes the fluid over to the side, and then we'll take it up to the armpit. Feel like kitty cat paws?
Yeah, it's definitely a sensation I have not had. It's starting to have a cumulative effect.
So you see why we don't do the whole body. Then we're working here on the intercostal spaces because of the drainage directly into the body. And you'll notice that the skin doesn't redden. It just stays a nice flesh color. If anything, there's a little bit of a whitening that occurs because there's a reabsorption of the blood back into the venous reflow system.
Now, why is this called a rotary?
Oh, this isn't the rotary.
Okay,
I've passed the rotary. That was up the back and over the side.
I'm zooming out.
Okay, now here we come rotary. And then a pump and a push. A traveling pump and push. The whole idea is to stretch the skin, move the skin to get those individual lymph segments moving along. Dr. Vader said that to maintain a healthy body, we needed to make sure that we were decongested. And what we do with MLD is that we help decongest the loose connective tissue. When Vader was naming his therapy, at that time the fluid that we now call interstitial fluid or pre-lymph or loose connective tissue fluid, it was called lymph. So he was draining by hand the lymph out of the loose connective tissue. But as so often happens in scientific nomenclature, things change. So now lymph isn't lymph until it's in the lymph vessel system. And since the arm also drains into the axilla, the deltoid area is where I'm working right now. we're stimulating the axilla and the terminus to help them take up more fluid. Most of the time when I'm working on a patient or a client, I don't talk, and usually they don't either because it's such a relaxing massage. I like to let them go to sleep. Okay, then normally I would go to the other side and then complete this side. So we're just going to pretend as if I had done that. So I'll just start. Well, I don't want to have my back to the camera.
I'm gonna pout.
Oh. Okay, here we have our rotary again.
Is that rotary? Are you twisting your palm? Is that what
Yes, there's a longitudinal and a diagonal stretch with all the movements that we do. That helps the lymphangions, or the lymph segments, pump their fluid onto the next little lymph segment. Each of these lymphangions, or lymph segment, is an independent segment, and it moves the fluid after it's been properly stimulated either by internal or external factors. And one of the internal factors is the amount of fluid that's in the area. My students always say, "Oh, you make that look so easy." I said, "Well, yes. How much confidence would you have in me if I made it look hard?" I remember when I was learning MLD, I would watch my instructor, Mrs. Whitlinger, who is from the Dr. Varda School in Austria. I'd look at her and I'd go, "How in the world does she make it look so easy?" So I said, "Well, she'd been studying for 20 years and teaching." I said, "Well, you too can make it look this good and this easy after 20 years." It's not for the faint heart to learn this. It requires a lot of dedication and devotion, a lot of willingness to put your ego aside and take a lot of correction. Because we're working on a very specific body system here, and it requires particular attention.
So the lymph system is pretty much the same in everybody? The pathways are pretty identical?
They're similar. They're, we have individual physiology, but it follows a basic pattern. Some people may have more vessels, some people may have fewer vessels. And in fact, with primary lymphedema, and primary is where they don't know what caused it, there was no preceding event, people may be born with it. A lot of times what happens with that is that there may be too few vessels in the legs to help move the fluid out. They think that's what's wrong in my particular case, because that's why my legs were swelling. And now it's managed. Like lymphedema, secondary lymphedema, and that follows an event, such as a trauma to the body or surgery like a mastectomy. And what happens there is that there's been an interruption in the lymph vessel system, which may be temporary or may be permanent. Temporary, for example, if you've got the old couch potato syndrome and you're not getting up and doing much activity, the lymph vessel system can become sluggish. Well, let's just say you had a revelation and you decided to start exercising. Well, that would help the lymph vessel system pump the fluid better. But if you had surgery and they removed lymph nodes or severed the lymph vessel system, the nodes, if they're removed, will never grow back. Whereas, so what that does is that it has a compromising effect on the body. And then, if you develop secondary lymphedema, it's a chronic condition. It never goes away, but it can be managed. Okay, and this is one of my favorites. This is a little deeper because we're working on right next to the spine in the erector spinae.
What's this called?
This is stationary circles, little soldiers, we call them, because the little fingers are in a straight line. This helps really relax the back.
When I drop the microphone, that means I'm asleep.
Okay. MLD is a very be here, be now therapy because I'm always feeling what is going on beneath my fingertips. I always tell my students that I'm constantly adjusting my touch to underlying histological findings, you know, to really just sound, wow, impressive, huh? But it just means that I have to pay attention to what I'm feeling beneath my hands. Because we have an axiom in MLD, the softer the tissue, for example under swelling, the softer the tissue, the softer the pressure. And conversely, the harder the tissue, like fibrosis. It's not uncommon to find fibrosis in a post-mastectomy lymphedema case, especially if they've had other types of therapy like the pump. I'm sure the pump works very well for some people. I just happen to see the ones that the pump either doesn't work for or has caused harm to.
So you're talking about a machine, not
right,
your
the machine,
Okay.
Sequential gradient pump or that type of pump. That's great for, you know, some edemas, but it'll never match the hands-on. Okay, so there you go. The back. And I see we're getting close to
The back.
our time frame here. Pass out, huh?
Does that mean I have to do something?
Oh, well, we could talk just a little bit. You want to sit up?
Let's talk a little bit.
Okay. What should we talk about? You feeling a little relaxed there, my dear?
Yeah. Oh, to use the microphone. Okay, so,
Focus and think.
Catherine Thrift.
Catherine Thrift, you got that. Dallas, Texas.
I remember one name anyway. So now when I'm coming up to Dallas, I can look you up, right? Do we have your phone number and address? Maybe we can talk about
I know
that
we've got
for a
the
second.
phone number.
There's a phone number for friends in Dallas. It's a local call, but everybody else will have to. But you don't mind people calling you from wherever they are to get information?
No, because...
Sit down and look at the cameras.
Sit down and look at the camera.
Look
Okay.
at you. I know
Okay.
she's been looking at me the whole time.
Okay.
She's interested in my health.
That's right. Well, we're longtime friends.
Yeah, yeah. Should we tell the story? We were seaweed, or what?
Seaweed in the ocean.
In the ocean. That's where seaweed is.
We had a class that we took together with body movements.
Right. We were seaweed. We weren't plankton or.
No, we were seaweed.
Okay.
So we could learn.
My memory's gone right now.
So, can you tell what you experienced with the MLD, how it's a little different from the classical massage or the Swedish massage that you've gotten?
It's definitely different, and it's hard for me to explain the way I feel. It's almost some kind of, I don't know if I'm more puffy or less puffy, but that's the word that comes to mind.
Well, we definitely have moved fluid.
Yeah, I can tell that it's like something's different, and it's different that I've never experienced, so I don't have any way to explain it. Maybe I need like an old timer at this. Okay, I see that our sponsors are starting to happen, so
oh, good.
I'm waking up.
Okay.
River City Home and Garden, they gave us some trees here tonight.
You picked out some good ones.
Derek you said now Derek was in your ortho class,
right.
orthobiology.
Orthobiology.
Derek, an ex-massage therapist down there at Barton Springs and South Lamar, just a little bit past Barton Springs, at River City Home and Garden. And I want to tell everybody to call our friends here, our sponsors.
Exactly.
Take a minute, give them a call, let them know that you're watching the show, because sometimes the sponsors say, well, we never hear from any of your viewers. And I hear from a lot of people. So give Jesse and Gerald a call, the Therapy Center. They're at the 25th and Longview. What is so funny, Sally? Jesse and Gerald at the Therapy Center. And Jesse came on the show and did the seated massage show on a nice table. I mean, her Oakworks chair. I think you did drain my head.
Took all those brains out of it.
Pro Tape down at 313 South Congress. I remember that. Pro Tape, where you get all your blank tapes. And thanks to everybody at Pro Tape. Body support systems with our body cushion.
You're going to use that in your segment, aren't you?
Right. I use a body cushion on my shiatsu and on the table. And they're an 800 number, so no excuses to not call them. Give a call down to the body cushion. Third Coast Massage School and Clinic down at BK's Road. I think it's 3425 BK's Road. Sherry and the gang down there at Third Coast Massage School. People ask me, which massage school? Third Coast? Richie, my rolfer, was on last month.
I really enjoyed watching that tape.
Yeah, you saw that tape?
Yeah.
It wasn't just the tie-dyed underwear. It was
No,
Richie. And people are calling Richie, so, and I'm sure they'll keep calling Richie because he's just such a guy.
He really looked like he was very involved in what you were doing and really didn't cause much pain. And I'd always,
yeah, it was very comfortable. You know, you always hear rolfing. It's like
yeah.
this terrible thing, but it's been wonderful. As a matter of fact, I was in Tuesday, and I feel great.
Good.
Oakworks supplying us with this great table here, the Havana Light. Oakworks also making massage chairs. Like I said, we use the Oakworks chair.
I love Oakworks. I have a couple myself.
This fancy deal here.
Whoops. Well.
It works great. Just a quick release deal. Let's go. Kind of like the bicycle. Never had one of those on my bicycle either. We always had cheap bicycles when I was a kid. And who else do we have? Oh, Habitat Suites. Now, Eduardo, we were down there at Casa de Luz. You met Eduardo?
Oh, what wonderful food they have.
That's right. Eduardo on the macrobiotic wave there. Habitat Suites is a green hotel, and they're over by Highland Mall. And maybe we can have our next state convention over at Habitat Suites.
Oh, that'd be nice.
Suga music with our. Now we've been listening to the classical bouquet, and that's on Suga music. And that's Stefan Placero. He's I think the president of Suga music, and he's translated all these classical.
Oh, they were really
orchestral.
some nice ones. Taco Bell.
Yeah.
Not Taco Bell, but Taco.
Yeah. I'm losing it. There's my number. And I will regain consciousness by the time you call me. Give a call anytime you got any questions about the Bodyworker massage. I know about this much about manual lymph drainage, but I have your phone number.
And our crew.
And our crew.
Weren't
now
they
you
wonderful?
know everybody. Charles
I
is
do.
the only one you didn't talk to. Charles in there.
Oh, I did.
At the control.
Oh, but I talked to him before.
Yeah, not during the show.
No.
And Kathy is not here, but everybody else is here. And they're doing a great job as far as I can tell.
They did a wonderful job. Thanks, gang.
And there it is. You need to get a hold of me, write me, shout me. Hopefully, Bodywork will be international, and everybody around the world will be saying, MLD,
Much
I
success
saw
to
it
you.
on the Bodyworker. We'll be back next week with more of the Bodyworker. So thanks for tuning in.